Hello, my name is Eugene Fried and I work for the Philadelphia Department of Health and Immunizations Outreach. And today I'm here to share findings from an analysis of the Vaccine Adverse Event Reporting System, called Vaers, data from 1990 to 2024. I used AI to help process and analyze the data, and the results seem to reaffirm the safety of vaccines. Some voices have raised concerns about vaccine safety, but we should attempt to break down the data and clear up some confusion with this analysis. VAERS is run by the CDC and the FDA, and it collects voluntary reports on potential side effects from vaccines submitted by healthcare providers, patients, and family members. Our study analyzed VAERS data from 1990 to 2024 to assess vaccine safety across different age groups. While VAERS helps identify safety concerns, it's important to remember that just because an event occurs after vaccination, it doesn't mean the vaccine caused it. Correlation doesn't equal causation. The key takeaway is that serious side effects are extremely rare, with most reported issues being mild or temporary, highlighting that the benefits of vaccinations far outweigh the risks. Vaccines are essential in fighting severe diseases like COVID-19, measles, and polio, with over 1.7 billion doses administered globally between 2020 and 2023, including 700 million COVID-19 doses in the US. Despite the large scale, the rate of severe side effects remains very low. Each year, millions of doses are given to both children and adults, protecting against diseases like the flu, shingles, and HPV. While vaccines are not 100% effective, they are overwhelmingly safe and effective, and continuing vaccine research and open conversation is vital for public health. Critics often highlight deaths following vaccination, with VAERS reporting 48,580 deaths, but it's important to note that VAERS is a reporting system, not one that determines causality. Many deaths involved individuals with pre-existing health conditions, especially in the older populations. While serious adverse events like death, life-threatening conditions, and permanent disabilities are concerning, they are exceptionally rare, and the most common report in VAERS is none of the above, indicating no significant adverse effects. The 2.9 million adverse events reported to VAERS, most are mild, temporary, and typical reactions like fever, which constitutes 13%, headaches, 11%, and injection site pain, 10%, which are common to most vaccines. Other symptoms such as fatigue, chills, and muscle aches are also short-lived and resolve within a few days. These reactions reflect the body's immune response and are not unique to COVID-19 vaccines, occurring with vaccines for diseases like polio and measles. Given the scale of vaccination, with millions of doses administered in the US, the rate of severe adverse events remains extremely low, emphasizing the benefits of vaccines in preventing serious diseases far outweighs the temporary discomfort of mild symptoms. Vaccines are an essential part of public health and have been shown to be overwhelmingly safe, even when administered to millions of individuals annually. As you can see in this graph, in the younger age groups, the majority of adverse events reported are non-severe, such as an office or emergency room visit, and these events are often not causally linked to the vaccine. For example, in the under 6 months group, there were 2,966 deaths out of nearly 70,000 cases reported in VAERS. These deaths may not be directly caused by the vaccine and are more likely associated with underlying health conditions common in this vulnerable population. It's important to note that these are simply reported events and no causality has been established between the vaccine and these outcomes. In older populations, particularly those aged 60 plus, a higher number of deaths and life-threatening events are observed, but these individuals have pre-existing conditions that make them more susceptible to severe outcomes regardless of the vaccine. Even in these groups, serious adverse events remain very rare. The benefits of vaccination in preventing severe diseases far outweighs the minimal risks, which are rare and generally occur in individuals with other health issues. Overall, the data that I looked at consistently supports that vaccines are safe and an effective tool in protecting public health. Adverse events following vaccination can occur well after the vaccine is administered, and many serious events such as deaths and life-threatening incidents happen more than 30 days post-vaccination, suggesting they may not be related to the vaccine. Many hospitalizations and emergency room visits also occur more than 30 days after vaccination, which kind of further supports the idea that these events are likely caused by factors unrelated to the vaccine. The majority of vaccine recipients report no adverse events, highlighting the overall safety of vaccines. The distribution of onset intervals indicates that delayed events are less likely to be caused by the vaccine and may be due to other medical conditions or factors. A large number of adverse events reported for COVID-19 vaccines reflect the global scale and intense monitoring of vaccination campaigns. With billions of people vaccinated in a short time, the Pfizer, BioNTech, Moderna, and Janssen vaccines received heightened attention, leading to more reports. In contrast, as you can see here, vaccines like varicella, MMR, and zoster have fewer reports due to their long-term use and less intense focus. The key takeaway from this slide is that the higher volume of reports for COVID-19 vaccine does not necessarily imply greater danger, but rather the unprecedented attention and speed of the vaccination efforts. A significant spike in reported adverse events started in 2021 coincided with the global rollout of COVID-19 vaccines, with over 1 million reports filed in Vaers that year, representing more than 40% of the total reports for the entire period since Vaers started monitoring events. Prior to 2021, reports were consistently low, ranging from 1,000 to 60,000 annually, reflecting the routine nature of vaccines that hadn't received the same level of global scrutiny. Following 2021, the number of reports declined significantly, with only 5.94% of total reports that were issued by 2023, indicating that concerns about vaccine safety had settled. This trend may suggest that the increase in reports was largely due to heightened awareness during the pandemic, and that vaccines, including COVID-19 vaccines, remain safe and effective. Recent cuts to vaccine research funding makes it more crucial than ever to emphasize the life-saving role of vaccines in public health. Vaccines prevent diseases, save millions of lives annually, and protect the health security of communities, especially children, as seen in the rise of vaccine-preventable diseases like measles and whooping cough. Despite political setbacks, vaccines remain one of the most cost-effective public health interventions, saving $10 for every dollar spent on childhood vaccines. To secure a healthier future, continued support for vaccination programs, research, and efforts to combat vaccine hesitancy is essential, as the benefits of vaccines far outweigh the risks. If you're interested in this study or know of any organizations or publications that might be interested in publishing it, please reach out. I will be happy to discuss further and provide a copy of my full research report. Thank you for your time.